Hello, and welcome to this edition of Johnson County EMS Continuing Medical Education. I'm your host, Captain Dale Johnson, Training Officer for Johnson County EMS. In this session, we are looking at options for the delivery of epinephrine in cardiac arrest situations. This is a mandatory session for all EMT intermediate and paramedic personnel within the Johnson County EMS system. Okay? So we're facing a dilemma. The Johnson County EMS system, as well as those from around the country, are facing increasing medication shortages. In the past couple of years, we have seen shortages in epinephrine, sodium bicarbonate, dextrose 50%, cardizem, and others, including normal saline IV solution. This has been an increasingly frequent occurrence and probably will continue for the foreseeable future. There's a lot of factors at play here related to the manufacturers, the FDA, the suppliers, and everything else. So this situation is not going away. Whenever we're notified of a shortage, they don't provide us with any kind of timetable as when we're going to be able to obtain a replenishment or additional supply. Assistant Chief Dave Dolan, our logistics guy for Johnson County EMS, when he gets these notices, he first sees the if there's any way he can obtain some more product from another source, and then he stays pretty much on top of it to, you know, get us the stuff just as soon as it becomes available. All right. With this, we know that epi is an essential part of our cardiac arrest treatment protocols, and even with discussions going on around the world regarding the role of epi, the drug will be with us for some time to come, so it's essential that we have an adequate supply. And the way our treatment protocols are set up, according to the latest science, it is very easy to go through quite a bit of epinephrine during a single cardiac arrest. Okay. For example, during a recent cardiac arrest call, the on-scene units administered 24 doses of epinephrine into 1 to 10,000 concentration, which is easy to do, especially when you consider A, we provide epinephrine every 3 to 5 minutes. All right, that's the guidelines. In actuality, in reviewing call reports, we're probably doing it every 2 to 3 minutes. All right, so we could work on it there, but still, there's still a lot of epi being given. We're also working cardiac arrest longer. Um, from a few years ago when we worked 15 minutes on scene and drive real fast to the hospital, we didn't use a lot back then. And then when we first started working calls on the scene, we uh, we did a lot. We did a lot of, work 30 minutes and quit. And we're seeing a lot of cardiac arrest now. We're working 40, 45, 50, 60. The longest one I've seen so far is 75 minutes. That one was ultimately terminated, but I have seen a 70-minute where return of spontaneous circulation was obtained in the patient's home now. So, we got to get out of that 30-minute and quit option, even though there are some cases where that's appropriate. Still, you know, doing 24 preloaded syringes of epi in a single call, that's probably not sustainable in the near future. So plan A is we use the little tan boxes. We got to have a plan B. All right. Plan B, that's options. Options are good. So we're looking at two options to help out the situation. The first option will be earlier use of an epi drip. The upside of this is that this method provides 1 milligram of every epinephrine every 4 minutes, which is well within the current 1 milligram every 3 to 5 minute protocol. And preparing the drip, as I'll show you how to do it, will provide that dosage of epinephrine over 48 minutes. Okay, so that's the upside. We got 12 milligrams, it'll get us through 48 minutes. The downside is that on that call, 18 milligrams of that multi-dose vial are wasted. We're working on a plan to address that as well. Okay. Another part of Plan B is use of EPI 1 to 1,000 single doses, either the ampules or the vials. And although this method does add a couple of extra steps, it is very doable. It's not that hard, not that complicated, but it does add a few more extra steps. And um, probably the idea is people get in, oh God, I'm going to have to add this and do this and do this and do this. It's not that, it doesn't add that much. Um, in previous shortages in other places, I've seen this done, and it's done very easily. So let's talk about the Epi drip first. As stated, it provides 1 milligram every 4 minutes, so that's well within the current guidelines. And since we do Epi every 3 to 5, there's plenty of time to put this drip together. Okay. Um, the idea is to give the first dose, maybe the second, but there's really no reason at all that this cannot be done after the first dose of Epi. You give the first dose the regular way with the preloaded syringe, and then you get the drip set up. Okay? The key is starting the drip early. Typically, what would happen, you get first vascular access, we get that first dose of Epi via the preloaded syringe, and then we set the Epi drip up. And you'll see there's not a lot involved in it, there's not a whole lot of parts, and it can go very easily. And then once you set it, you're good for 48 minutes. All right, so we'll look at that. There are some stuff that you need. Okay, the few items that you need. First, you need a 250 normal saline bag. You need a 10 drop set, not a 60 drop, a 10 drop set. You need a 30 milliliter vial of the 1 to 1,000 epi, what we typically call our multi-dose vial. You need a 20 milliliter syringe, and you need an 18 gauge needle. I choose the 18 gauge needle because it's either easier to draw the, the, the fluids through that needle into the syringe. Okay, that's all you need, and you can look at this and tell this is easy. All right. The process for setting up the drip is this. When setting up the drip, first verify that the epi and the normal saline are in date and ready to use. This should be our normal thing, in that we always, anytime you're using a drug or a bag of fluid, look at the date. You're also looking at the label to make sure that it's what you need. All right. Use the 20 ml syringe and the 18 gauge needle. First, you're going to draw 12 cc's or 12 mLs of fluid from the 250 bag and waste it. Shoot it out on the floor, out on the ground, back into the little excess bag that you open to get the epi out or get the IV fluid out. But that first 12 cc's of fluid that you pull out of the IV bag, waste it. All right. Then, using the same syringe and needle, carefully, because you've got a sharp here, carefully draw up 12 mLs of the 1 to 1,000 epi, which is 12 milligrams. All right. Then inject the epi into the 250 saline bag. Shake it a couple of times to mix it up. All right. Now dispose of that 20 ml syringe and needle properly in a sharps container. All right. We don't want any added sharps injuries. All right. So now we're ready. Attach the 10 drop set to the 250 bag and flush the line. Now, you don't want to waste a lot of this because you've got a pre-mixed mixture, so watch it run just enough fluid to flush the line, and don't run a little puddle out on the floor. All right. Attach the IV line to the existing IV line going to the patient, or to a separate line. Ideally, it should be on, you should have two lines going, and there's nothing wrong with bilateral IO lines, or get your first IO line, get the first dose of epi, hang the drip. Okay, now you've got a few minutes to, you know, look for an AC, drill the other IO. I know there's some people that will jump on the EJ, but I'd rather, see, one of the ACs or a hand, forearm vein or something like that. Okay. The drip's attached. Run it at 1 drop every 1 second, or 60 drops per minute. And what this does, it gives you 1 milligram of epi every 4 minutes. Remember, the dose is every 3 to 5, so you're hitting this right in the middle. And by hanging the drip, now you can focus on other things. The only thing you've got to do is verify that the drip is running at about 1 drop per second. Okay, so we're kind of looking at a drop, 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 drop. That's about 1 per second. Okay, there's a lot of apps that you can put on your smartphone to help you out with this. Okay, so this shouldn't be running too fast or too slow. Gives you 1 milligram every 4 minutes, and this will last you about 48 minutes. Okay, because you got 12 milligrams, you're running about, it's given about every 4 minutes, so that'll run you out to 48 minutes. Again, ideally establish the second IVIO line, because sometimes there's cases where medications don't mix very well. Calcium and sodium bicarb, they typically don't do well. So pop up a second line. All right. And remember, if you obtain a return of spontaneous circulation, stop the epi infusion. All right. Stop it. So that's the drip. Now, what happens if we simply cannot get any more of the preloaded 1 to 10 preloaded syringes for an extended period of time? Okay, we got to have a different plan for it, and it's quite possible that we can run into shortages where we don't have that. All right, so it's possible to make single dose epi 1 to 10,000 utilizing the 1 milligram 1 to 1,000 ampule or vial. Okay, there is a couple of extra steps, but it's very doable. All right, for each dose you're going to need the 1 milligram epi 1 to 1,000 ampule or vial. Okay, you see that right there. You're going to need a filtered needle, you're going to need the saline flush, and you're going to need a gauze pad. Okay, and remember, these are each dose. Now typically you're only going to be administering 1 or 2 of these, so it's not like we've got to go stock up on filtered needles or anything like that. Okay, so the process, we're going to give our first dose utilizing this method. Remember, verify the expiration dates of the saline flush and the epi. That's the first thing. Verify, verify, verify. Open the 10 ml saline flush and waste a milliliter of that solution, then attach the filtered needle. All right. Prepare the epi. You're going to have to thump the top a couple of times to get everything out of the tip down into the main body of the vial. Grasp the tip of the ampule with the gauze pad and break off the tip. All right. Then you're going to take that saline flush with the filtered needle attached and insert it into the ampule and draw up the medication. All right. As soon as you do that, expel any excess air from the saline flush. Then remove and properly dispose of the filtered needle. It goes in a sharps container. It doesn't go on the ground, the floor, the bench seat, or anything. It goes in a sharps container, period. Okay. Now, if you're using the vials, because EPI 1 to 1000 is available in vials, you're not going to need a filtered needle. You're just going to need a regular needle. And then you just pop the cap off, draw it up. Okay. Most likely, we're going to have ampules for the foreseeable future. Um, it just seems like for whatever reason, it's more common. All right. Now you've done this, you should have 10 mLs of solution in the saline flush at this point, which is going to consist of 9 mLs of normal saline and the 1 ml of that epinephrine 1 to 1000 solution, which with this mixture you have 1 to 10,000 solution now. Attach the saline flush to an access port on the IV line to the patient and inject the med. All right, and then dispose of the saline flush. All right, you don't have a needle attached, so you may lay it on the floor or something like that. But anytime you got a needle, don't be laying those on the floor. All right, go ahead and dispose of them quickly. With this process, remember it can easily be accomplished in the 3 to 5 minute time span between epi dosages. Okay, um, it's really very quick to do this. Um, just have all your stuff together so you don't, okay, let me get the syringe. All right, now, wait, now, let me get the needle. I got to find that. It's over in this other pouch. And then the EPIs, and we have to be some pre-planning once we get to this point where this is the normal thing we're doing. We probably need to look at putting the materials together in one place. All right. And then with this process, also remember to grasp the tip of the ampule with a gauze pad, since failure to do so may result in an injury to the provider, namely you. Um, it doesn't look like much, but I have seen those little ampules cause some nasty cuts to people's finger and thumb. Okay, because it's very sharp and yeah, it'd be kind of nasty. And then there's all the paperwork and everything else. Okay. So, thanks for watching. Like you had a choice, right? If you have any questions, let us know. You can contact Assistant Chief Billy Langston at Johnson County EMS. Everybody should have his contact information. You can also contact me, Captain Dale Johnson, over here at Johnson County EMS. Everybody should know how to get hold of me. And we will answer any questions that you have. If we ain't got the answer, we will daggone sure find it. All right, because that's what we do. Um, we're going. There will be an announcement sent by email to confirm when these guidelines will go into effect. We may implement the Epi drip earlier. That is something probably you could see in the very near future anyway without waiting for a shortage. Um, and then the 1 to 10,000 creation out of the ampules, that's something that's kind of like a plan C. And it's always good to have plan C. All right. So now you've watched the video, you got the knowledge, you got the information. I got a survey monkey for you. You go to here. This is really easy. Basically, when you go to this link, you're going to put your first and last name. Make sure you put first and last name. All right. Um, and then your credential level, your primary provider. If you're a full-time employee at Johnson County EMS, that's your primary provider. You may be a full-time employee at say 5210 EMS and you work part-time for us at Johnson County EMS. 5210 is your primary provider. And then there's a little statement that you've got to say yes or no to, which basically says, I have watched the video in its entirety. I accept responsibility for knowing the material, and go at it from there. You'll get a 30-minute continuing ed certificate that'll go in cardiology for watching this video and completing that um, little quiz. All right. So again, if you got any questions, please let us know. Thanks for watching. Y'all be careful out there. Wear your seatbelt. Slow down. And if you need anything, by all means, give me a holler. All right. Take care.